In my early 20s, I developed rheumatoid arthritis, and along with a couple of other related conditions. And my experience of my experience of developing that condition, and how the system and the healthcare professionals engaged with me, really influenced my future direction in terms of my career and professional development, and my desire to really want to support others to influence the system in order that they didn't have to go through some of the things that I had to go through, but also the realization that there was a better way of supporting the engagement between patients and healthcare professionals. In the faculty, I facilitate on a number of the leadership programs, so supporting healthcare professionals as they aspire to leadership positions and on their journey to get into positions of influence. And I support the design and facilitation of programs, and I support individuals on those programs to really look at their professional practice and the behaviour and skills that underpin their professional practice. And what I do is I bring particularly a couple of things. So firstly, I have experience of working in the healthcare system in a leadership management position. So I understand the pressures and the stresses that the participants are going through in terms of their daily work lives. And the pressures and stresses underpinning the decisions they have to make, the choices they have to make. But I also bring my lens of being a patient in the system. And I think I bring a very particular lens because with my chronic condition, I have a different relationship to those who might engage with the system, but on a either very transitory or very episodic basis. And what I mean by that is often people say, but why do we need you in the room, Mark? Surely we're all patients. We all have that experience. And I would say, well, there's a very distinct difference between myself with a long-term chronic condition and somebody who, and I really don't want to devalue this, but there is a difference here. Somebody who, let's say, a member of their family or themselves has had an accident and they had to use accident and emergency. And accident and emergency, that care was there when they required it, and it supported them when they needed it, got them back on their feet, and they got back to life. What you'll often hear those people say is, thank God that service was there when I needed it, and thank God I've been able to go back to normal. My life's back to normal. And there is the rub, because normal for me is the quality of my relationships with the healthcare system and the healthcare professionals. I access primary, secondary, community care, I would say about 3 times every 6 weeks. And the relationship between the system and me in how it's set up, how it works with me, and the healthcare professionals, the quality of that relationship really impacts my ability to live a well and fulfilling life with my health condition. When those relationships don't work, when things break down, when communication between secondary and primary care isn't as effective as it could be, that has a direct impact on the quality of my life and the quality of my care. So I bring that lens to the work of the faculty. And how I bring it is really important. Because one of the things that, as a patient leader, I'd like to think I'm competent at doing, is supporting healthcare professionals to really reflect and think upon what they often take for granted in their professional work. So I support healthcare professionals at the faculty in my role to really question their behaviour and the actions they take, the decisions they make. I help them to reflect on the assumptions underpinning that. So the choices they make, why did they make those choices? What were the assumptions underpinning that? What were the beliefs they hold? What was the data and information or the reality that underpins those decisions and choices? Have they thought that through? Were there other choices or decisions they could make? Was there other data that they could have chosen? So I tend to make the unconscious conscious. I tend to support them to reflect on their biases, their habits, their blind spots. And I do that by asking questions to just get them to reflect on their thinking. And I think I also, in those questions, continually support the healthcare professionals to connect with often why they went into their work in the first place, those values and principles that are so important to them, that in their daily, everyday life of making those hard management decisions, they can lose that connection with those values and principles. And those values and principles are so important because when we talk about the patient being at the centre of the care, that often requires different conversations to be had between healthcare professionals. And it often requires a different mentality and a different way of thinking. So I bring that dialogic mindset to work alongside what often they're very good at doing, which is a diagnostic mindset. I bring that different way of connecting with their thinking. Sometimes I like to say I connect the head with the heart, the intellect with the emotion, and know that by connecting with themselves and developing that self-awareness of who they are and the decisions they're making, they really truly will see the 24-year-old sat in front of them rather than a bunch of symptoms if they're clinicians, or maybe help them to reflect on making managerial decisions, think through, well, I wonder what the impact will be on patient care with me making this choice. I think to get meaningful involvement in the education of healthcare professionals, we really need to think about how we approach it and what we're trying to achieve through that engagement of patients. So unfortunately what I sometimes see is patients often literally being wheeled into a lecture theatre or a seminar room in order to tell their story. And I think it's how they tell their story that is potentially, there's a lesson to be learned. So if the patient is just brought in to tell their story and then they leave, what I think the challenge is have the healthcare professionals really had an opportunity to get the most learning and insight from that experience? And I would question whether that's happened. So I think what the patient can do is, by having a patient in that room and telling their story, there is a thing that needs to happen with that story. The patient, it's really powerful if the patient can then engage in a conversation with the healthcare professionals, with the professionals in the room, to support them to really reflect and think about that story. Because I've seen too many times where healthcare professionals will listen to a story, they will filter it through their lens of their understanding and make sense of it through those assumptions and through their beliefs, often unquestioned, often based upon their years of experience or their education to date, and the way they view patients, the way they traditionally engage patients through that medical model mindset. So they will see that story through that lens. And I think the power of a patient story is to provoke, to challenge healthcare professionals to think differently, to see differently. The key thing is to provide that provocation to support a questioning of one's assumptions, one's beliefs, one's thinkings. The ability to ask oneself questions. How do I know? So here's this patient, here's what they're presenting, this is what I think they're presenting. But how do I truly know that? How do I truly understand that? Maybe I need to question. Maybe I need to listen differently. Now, the patient can provide the healthcare professionals with the opportunity to do that by the quality of their questioning, by the quality of their dialogue, by the quality of how they support the healthcare professionals to inquire into their thinking. And that is a real art, that's a real skill, because it can challenge quite a mentality that we often find, which is debate, where people will sit around a table, they will present their views and opinions as the truth, as fact, and then they will go into supporting that by listening to another person, purely and simply, often, to check out whether they're hearing the person say something they can disagree with, and jump in, give an answer, give a challenge to that person, tell them why they're wrong, and present them with reasons why they need to listen to them as providing the answer. Well, patients can challenge that mindset. They can actually say, do you know what? We all hold part of the truth here. We all are seeing the same thing, but possibly from different angles. I wonder how we can explore this together. I wonder how we can find new solutions to old problems by engaging in different conversations. Conversations built on the quality of that questioning to seek to understand the other person, their assumptions, their viewpoints, to try, if you can, to ensure that you're not, you question your judgments, that you hold an open mind, that you say to yourself, do you know what, there might be things out here I don't understand and I don't know. And patients can do that, but patients can often only do that if they've been supported and skilled in doing that. So you're doing, often in the education of healthcare professionals, we're doing ourselves no favour by wheeling patients in to tell their story without supporting those patients to have the skills and the ability to engage in a different conversation. Otherwise, you'll get the self-fulfilling prophecy. You'll get the patient behaving and acting exactly as the healthcare professionals are expecting them to do, and nothing happens, nothing changes. So, yes, patients can truly support healthcare professionals to see and think differently and create the healthcare service we want.